This is one of the most important tests you can do to check midfoot mobility and overall health of the lower extremity. So when we look at this test, what we want to look at is the ability for this person to passively get into pronation and supination. If they don't have the mobility to do it anyways, all the exercises that you do to restore it, if they're not mobility related, won't really work. So we want to make sure they have the capacity here. And here's how we check it. We take their foot and we take our index finger and we run along the inside part of the foot until we get to that first little crevice. And what that is the space between the first metatarsal and the medial cuneiform. I want to stabilize that foot and grasp that foot on the metatarsal side, which is the closer side towards me or closer side toward the toes. And the crevice on the other side is that whole midfoot. Now, since I've stabilized the side I'm on, which is the metatarsal side, there's actually movement allowed just at the toes. Now from here, what I'm going to say is I'm going to say bend your knee up until your foot's flat. And I'm going to make sure I hold it in a neutral position. And now I'm going to say, can you let your knee kind of fall off to the outside? And we want to see how much motion they're getting. Now, George is getting about 10, 15 degrees here. We generally want to see anywhere closer from 30 to 40 degrees. And what we want to see here is if they don't have it, we want to work on drills that allow us to get pronation and supination in the foot, because that'll allow him to get into internal, external rotation positions much better at the hip and allow for a better gait cycle and other things that he requires to be both an athlete and a human.